Goeienaand, good evening, fellow South Africans and citizens of the world. And a growing number of people involved in the healthcare industry in South Africa are now being infected by the coronavirus. And we've reported on how many have not been given masks and have the proper protective gear when they're dealing with patients, and now the chickens are coming home to roost. And when you've got such a shortage of healthcare workers in South Africa, this is not a good thing, especially with what's coming in the townships. A growing number of healthcare workers have been infected by COVID-19, Health Minister Zweli Mkhize said on Saturday evening, as the national tally rose to 1,187. That's confirmed cases. I would suggest that the actual number of people carrying coronavirus right now in South Africa is probably to the tens of that, i.e. tens of thousands. They just haven't been identified. A total of 13 healthcare workers, including 11 doctors, have been confirmed to have the coronavirus, but none appear to have been infected by patients, he said, in a statement issued as South Africa neared the end of the second day of the 3-week national lockdown ordered by President Cyril Ramaphosa to try and curb the spread of the disease. Mkhize said protecting frontline healthcare workers from the flu was a vital aspect of South Africa's strategy for combating the pandemic, and they would be given priority in receiving the vaccine, which was in short supply. South Africa has received very limited stock of flu vaccines, which had been ordered a year ago, well before the emergence of COVID-19, he said. He said, as governments, we have engaged with the pharmaceutical industry, and it became clear that the distribution of this vaccine has to be rationalized and prioritized. Now, remember, this isn't even for COVID-19, this is for the flu. We have therefore taken a decision that health workers in the country will be given priority in receiving the flu vaccine. The country cannot afford to have them sick, especially as the flu season approaches. This is one of the major lessons that we have learned from countries that have experienced the COVID-19 pandemic. We therefore plead for the understanding of all South Africans who may unfortunately not have access to the flu vaccine this year. The number of COVID-19 cases in South Africa has risen rapidly since the first one was announced on the 5th of March, and it now has more than any other country in Africa. However, Saturday's total is a relatively modest increase on Friday's figure of 1,170. Mkhize said this was no cause for celebration. Of course it wasn't. They've got such a backlog on tests that have been done, and they're doing so few of them. They're way behind what's actually going on in South Africa. It's absolutely ridiculous. Anyway, Mkhize said, we must outrightly state that these numbers do not indicate a reduction in the number of infections. It is merely a reflection of positive results that were received, verified, and ready for today's reporting. Exactly the point. So far, only one person is believed to have died from the coronavirus in South Africa. Gauteng remains the epicenter of South Africa's outbreak with 533 cases, Western Cape has 271, and KwaZulu-Natal 156. The Free State has 68 cases, while the Limpopo has 11. Mpumalanga and Eastern Cape each have 10, while the Northwest has 6, and the Northern Cape has 5. However, 117 cases are unallocated to provinces, because the paperwork for these patients was incomplete, which means they can't track them down. Just ridiculous. Mkhize said the South African citizens who were repatriated from Wuhan a fortnight ago had all tested negative for the coronavirus and were making preparations to leave their quarantine site at the Ranch Hotel in Limpopo. Wow! They've had an amazing 2 weeks in this top resort, costing the taxpayer millions of rands. You know what they do in China? You know what they do anywhere else in the world? They put these people into a low-cost building, but not South Africa. No. You wonder how many of those young people who came from Wuhan, China, are children of, yeah, you got it, the ANC elite. That sounds very much like what's going on here. Anyway, let's get back to the story. South Africa would be participating in an international clinical trial overseen by the World Health Organization to test potential therapies for COVID-19. The Solidarity trial will investigate remdesivir, which was previously used in Ebola trials, the HIV/AIDS medicine lopinavir, ritonavir, a combination of lopinavir, ritonavir, and interferon beta 1A, used for multiple sclerosis, and the malaria drug chloroquine and hydroxychloroquine. The South African research team is headed by Professor Helen Rees, the chair of medicine's regulator, and Jeremy Nell, who will coordinate 30 scientists from the South African Military Health Service and 8 medical schools, he said. These include WITS, the Sefako Makdao University, the University of Pretoria, the University of Cape Town, Stellenbosch University, Nelson Mandela University, the University of KwaZulu-Natal, and the University of the Free State. They will be undertaking the study in 14 leading hospitals across the country, said the minister. South Africa doesn't have leading hospitals. It has places where people go to die. It's like the morgue. That's how absolutely disgusting every hospital, and I'm talking public hospital, is. They will be undertaking the study in 14 hospitals across the country, said the minister. Other participating countries include Argentina, Bahrain, Canada, France, Iran, Norway, Spain, Switzerland, and Thailand. So there's the latest update, guys. 1,187 official cases. Believe me, it's a lot higher. And in the townships, whew, are they in for a surprise? All right, guys, please remember to subscribe to be kept informed. Ring the bell for the updates. Please like this video. Please share this video. And above all, please stay safe.